health screening events because those are the events where you can get most of your hands-on practice.
I love how they offer health screenings throughout the year. It allows you to not only practice with the actual screening, but practice talking to the patients.
Get involved now than later because these are, especially at these health screening events.
This patient was confused. She was discharged from the nursing home facility that we supplied the medications to, but no one did any counseling, and if they did, it was very brief medication counseling. She was wondering how she took warfarin twice in the nursing home facility, twice a day, and right now it only says once a day. And she was swearing that she took warfarin twice a day. And when I went through her medication list and I explained what each medication was for, which again she did not know, and she made notes as I was on the phone with her, she realized that she was confusing the warfarin tablet for the levothyroxine tablet. So she took the levothyroxine in the morning, the warfarin in the evening, and she was thinking she was taking warfarin twice a day. So just to show you basic knowledge that we pharmacists think is very basic, very simple, very easy to understand. A lot of these patients do not know, especially if you're working with patients of either old age or young age. Always reiterate the information to these patients.
So for some of our patients that were recently discharged from the hospital, we'll do an initial consult for them. Once they are released from the hospital, then we'll do a 10-day follow-up just to make sure everything's going okay, and if they have any questions or concerns, we'll go over that. So I did have a patient, as I was doing the initial consultation with them over the phone, I realized that they were both on losartan and olmesartan, and they're both in the same class of medications, and I had asked the patient as well, did the doctor mention to you whether you're supposed to stop one of these or start replace it with another, or whether you're supposed to be on both of these medications. And a lot of patients, even though they sound similar, they don't realize that they're similar medications. So I kind of had to tell the patient, they are in the same family of medications, they work pretty similarly, and you're not really supposed to be on both of them at the same time. Usually it is one or the other, and taking both of them simultaneously can lead to certain side effects and things. And so I went over that with the patient on my initial consultation, and she had a follow-up with the doctor, I think coming up the next week, since she had been discharged from the hospital. And so when I did my follow-up with her, the 10-day follow-up, I did ask her, hey, did you mention to the doctor, or go over that with the doctor and see what you were supposed to be doing with that medication. And I remember she was very grateful that I had mentioned that to her, because she wasn't supposed to be on both of those medications. And I think sometimes that is a big concern, especially with patients who are recently in the hospital, because sometimes they do make changes to medications in the hospital, and a lot of patients may not know or notice that even though they do discharge counseling, they go over these things, they still might be confused about certain things with their medications, and so they may not realize that they should not be taking a medication, or they may have been switched to a different medication. So I think she realized that, and she was very grateful, and so she did appreciate that, and I think that was pretty rewarding.